Welcome to our track on autistic health. In the following weeks, we're going to be looking at physical health, mental health, barriers to healthcare, and the quality of life of autistic people. This first week focuses on physical health. We know that autistic people often have other physical health conditions. Jill, can you tell us a bit about why this happens?
So in terms of our understanding about autistic people, we think that genetics are important. And it seems likely that the genes that are to do with being autistic or being not autistic might also have a part to play in determining whether or not, for example, somebody has epilepsy, or whether or not somebody has anxiety, or whether or not somebody has difficulties around sleeping. It would make sense, I think, that whatever's happening genetically, that's determining autistic, not autistic, might also be a factor in some of the other co-occurring conditions. But I'm not convinced that's the whole picture. And I wonder whether you might have some ideas about other things that we might need to consider.
Sure. So I think there are different things that impact on physical health. And so, as well as the sort of genetic predisposition to certain conditions, there are also more psychosocial factors that influence our health. And so we know things like stigma and discrimination has an impact on people's mental health, but also such experiences can have an impact on physical health conditions. There are also difficulties where autistic people often have a number of co-occurring conditions, and this can lead to diagnostic overshadowing, where one condition is seen as explaining what is happening for someone, and therefore other conditions are not considered and not diagnosed. And we also know that there are real barriers for autistic people in accessing healthcare. And so I think we need to consider all these different things that may contribute to these other conditions that autistic people often have.
This week, we're going to be looking at and thinking much more about mental health. We know that many autistic people have co-occurring mental health difficulties. I wonder if you could say a little bit more about that, George.
Sure. So the statistics on this are really quite frightening. So we know that autistic people tend to die younger than non-autistic people, on average 16 years younger than non-autistic people. And one of the main causes for that is suicide. So research has shown that 66% of autistic adults have considered suicide. And autistic teenagers are at risk of suicide that is 28 times higher than for non-autistic teenagers. We know that autistic people have mental health conditions such as anxiety and depression, and the research has shown that around 70% of autistic people have a mental health condition, and around 40% have more than one mental health condition. We also know that at some point in their lives, about 50% of autistic people will self-harm, and that 35% of autistic people do meet criteria for some form of eating disorder. So, and there are many more statistics like this, which show just how dire the situation is for the mental health of autistic people.
Why is that, George? Why are those figures so distressing?
Well, I think it's twofold. To some extent, there are other conditions that autistic people are likely to have, in some cases just as likely as non-autistic people. So there are conditions which I think of as more sort of organic differences. But I think an awful lot of autistic mental health is more reactive to being in a world that is not designed for us. And so in many cases, it's the difficulties with not being understood, the miscommunications, the way that we're perceived, the stigma and judgment of autistic people, that, you know, where people are telling us that we're getting things wrong constantly. I don't think it should be surprising that we're depressed and anxious about this, that many autistic people end up traumatized by their experiences.
What do you think we need to do to improve autistic mental health?
Well, I think it's really about having better informed services. So at the moment, mental health services are for the most part really just not set up to support autistic people effectively. We're often told we're too complex, and the system really just does not work for us. In some cases, it's actually quite harmful when people try to engage with mental health services. And so an awful lot of mental health professionals need a better understanding of how mental health works for autistic people. And also in society more widely, we need to reduce that stigma and promote acceptance. So there's research which shows that where people are more accepting of being autistic as their social identity, that has been linked with better mental health outcomes. So this is something that we should really be teaching across all areas to reduce that stigma and promote acceptance of autistic differences.
Okay, and so that's something that we will be looking at much more over this next week. This week we're going to be focusing on the barriers to being able to access healthcare, and I suspect most people will have quite a good awareness of physical barriers in terms of being able to access healthcare, and people might have thought about the barriers to healthcare that exist for people with intellectual disabilities who are also autistic. But barriers to healthcare exist for all autistic people. George, I wonder if you might be able to tell us a little bit about either some of the research or some of your experiences around barriers to accessing healthcare.
I think what you said is a really important point. I think people will look at an autistic person like me and the many ways in which I am able to do things like contribute to this course, and they will then make assumptions about other things that I can and can't do. So there are many ways being autistic creates barriers to healthcare for me, autistic differences. So difficulties with communication, one thing I really struggle with is using the phone. I'm not able to use the phone, and there are very autistic reasons for that. But trying to get healthcare professionals to communicate with me in a different way, to use video calls, to contact me by email and things like that is really hit and miss. So some services have been brilliant. They'll contact me by email and I can do things like set up appointments over email or on an online system. Other healthcare services simply refuse, and there's just really no way of me contacting them unless I get a support worker to make a phone call for me. And then that makes things really complicated. It depends on my communication ability to ask a support worker to make that call for me, which isn't always easy, to ask for help. And then there's this sort of three-way conversation where I'm trying to get the right information to the healthcare practitioner and just get my needs met. And that creates so many barriers. Also things like executive functioning difficulties. So it can be really difficult for me to organize myself to sort of get to appointments, all the other things that are happening in my life in order to do things like that. And also even sort of things like anxiety. I really struggle to do things like open post because once I open an envelope, I then have to do things about it. And I don't necessarily have the capacity to deal with whatever it is at that point in time. And then it gets forgotten about and I put it to one side and then it sort of comes back to haunt me later and all these things. And then I miss appointments because I haven't opened the letter telling me about the appointment and things like that. So there's a lot of ways where I try to self-advocate and ask people to make adaptations to their services so that I can access them. And even though I'm really privileged in many ways, I am relatively articulate, I'm able to kind of explain my needs, I still find huge barriers in actually accessing healthcare.
Okay, thanks, George. So throughout this week, we're going to be exploring more about barriers to healthcare, and then we'll come back at the end and reflect on some of the issues and think about ways in which we might improve access to healthcare. So this week we've been thinking about access to healthcare and barriers to being able to access healthcare. We all need to be able to access healthcare when we need it, where we need it, and how we need it. And it's definitely the case that there are services, healthcare services, who employ staff who really don't have knowledge about autistic people and about the needs of autistic people. But it's also the case, I think, that there are services where staff do have knowledge about the specific needs of autistic people they're providing healthcare services to, and where those barriers really still exist. George, I wonder if you could perhaps reflect on why that might be the case.
Well, I think it can often be difficult, especially for non-autistic people, to really understand autistic needs, particularly as there can be a lot of variability even within one person. So we know there's also variability across many different autistic people who will present in very different ways. But also within one person, someone's needs can change really quite rapidly. So one day a person might be able to speak verbally, another day they might not. And that variability can really throw people because they expect someone to be able to do something that they've seen them do previously. And similarly, I think most people make assumptions based on their experiences, and their experiences are going to be predominantly with non-autistic people. And so that they make a sort of snap judgment that if someone's able to do one thing, they're able to do another thing. And so they just don't understand really the spiky profile of autistic people, where those strengths and weaknesses aren't at all balanced. And so it makes it difficult for them to kind of resolve what they predict a person will be able to do with what the person is they're asking for. And a key problem is that often healthcare professionals simply don't believe autistic people. And this is incredibly dangerous. This is literally killing people, because what happens is you get autistic people going, for instance, to mental health services and saying, I feel suicidal, I'm going to commit suicide. And too often mental health professionals say things like, well, you don't look suicidal, you're not behaving in it. They make those judgments based on a non-autistic model of what a suicidal person looks like. And they think, oh, well, this person isn't a risk because they're not presenting in a non-autistic way. And the same happens across all areas of healthcare. Things like pain, where autistic people might have different experiences of pain. Autistic people might struggle to use things like a pain scale and sort of rate their pain from 1 to 10. That might be completely meaningless for an autistic person. And then you've got healthcare professionals saying, well, you need to pick a number. And this means people are going undiagnosed. They're not having their pain acknowledged because, again, they're not presenting in a non-autistic way. They're not sort of doing the right pain face to get the appropriate amount of support. Mm. So I think all these are things that professionals need to be really aware of, because this is contributing to the mortality rate of autistic people.
Yeah, I really worry about people being able to access healthcare in the first place, and I was really struck by what you said about autistic people not being believed, and so I've certainly heard people, autistic people, saying, my GP says I have to phone to make an appointment. I'm not able to make an appointment using the phone. I've asked to access an appointment in a different way. And whilst I whilst I can appreciate that if you don't know about autistic people, you might think that that request doesn't make sense. But if somebody's asking for something different, I guess I don't understand why you wouldn't try and facilitate that, regardless of whether or not you understood why that different way of accessing was needed. And it seems to me that they're often little inexpensive things that would make quite a big difference. What do you think some of the consequences might be of autistic people struggling to access healthcare?
I think a major one is often autistic people find they need to mask, they need to act in a non-autistic way in order to access healthcare. So, for example, when my daughter was 6, we had an on-the-day appointment, so I didn't know which GP we would be seeing. And on the way there, she asked me if it was a GP who knew how to be kind to autistic people. And because I didn't know who we were seeing, I had to say, well, I'm not sure. And she thought about it for a moment and she said, well, shall we pretend we're not autistic so that they're kinder to us? And at that point, we haven't talked about masking or sort of pretending to be not autistic. This is something that she realized age 6 on her own, that there are times when actually things go a lot better if we pretend to not be autistic. If we try to act like non-autistic people, then it's a lot easier for us. And obviously we also know about the link between masking and worse mental health for autistic people. So it really puts us in an impossible position if, in order to access services, we need to act in a certain way that ticks the right boxes so that we can actually get the support that we need.
So in the words of your daughter, we need services that are kind to everybody, and that includes autistic people, and we need services who will believe the requests that are being made. It would be great if we had services that understood the needs of autistic people, but even without that understanding, it's important that services still facilitate people to be able to access and listen to what people are asking for.
I think that's an important point. It's not, people don't even necessarily need that knowledge and understanding. If an autistic person or anyone is coming and saying, I need this done in a different way, it's very unlikely we're doing it to be difficult or to get some sort of special treatment or because we're lazy, or, you know, this is something, if we're asking for it, we need it. And if people could just act on that, that would make such a difference to many people. So in the first 3 weeks of this track, we've looked at physical and mental health and many of the barriers that autistic people face to healthcare. We're now going to take a step back and look at the bigger picture here and focus on the quality of life of autistic people. So Jill, could you tell us first, what is quality of life? What do we mean by that? And why is it important?
So quality of life is something that's quite complicated, and that depends on a number of different factors. And so, for example, our quality of life might be influenced by the relationships that we have with other people. It might be influenced by what we have around us in terms of our possessions and somewhere to live and those kinds of things. It will be influenced definitely by our physical health. It will be influenced by our emotional well-being. And so there are a lot of different factors that are interrelated that come together to give us what we think of as being our general quality of life. And it's partly about how satisfied we are with the circumstances that we're living in and the opportunities we have to spend time doing the things that we like to do. And so quality of life is really important because it impacts on our emotional well-being, it impacts on our physical health, and it really it is something that we should be making sure we're thinking about if we're supporting anybody, including supporting an autistic person.
So how do we actually go about measuring quality of life?
So there are different definitions of quality of life, and most of those would have a number of different domains. And it might be that you can spend time or sort of watching somebody or walking in their shoes and see what their life's like, and then make some judgments about their quality of life. And so you might look at how much time somebody's spending working, how much time somebody's spending interacting with friends, how much time you might look at the quality of their living environment, and you might use that information to come to a judgment about their quality of life. But I think that that's tricky, because quality of life is actually something that's quite subjective, and because there are so many different factors that need to be considered, really, to get a more rounded view of somebody's quality of life, you need to get that information directly from the person. And of course, if you're thinking about an autistic person who has intellectual disabilities, that might not always be possible in terms of the communication or cognitive challenges somebody has. So you can watch somebody and make some judgments from that. You can ask people directly, or you might want to talk to other people who know that individual really well and ask about quality of life. But of course, all of those judgments are made against this standard of what quality of life ought to be. I wonder what you think in terms of some of those standard measures of quality of life, and whether they are always relevant for autistic people.
I don't think they are. I think, as you said, it's very subjective, and quality of life is something that's very individual. And often we have these ideas, if people are looking at autistic people from the outside, they might have very normative ideas about what is important to someone and what should be important to someone. And so for some people, the most important things in their life might be making money or having a family, or sort of doing things that are typically considered successful. But for some autistic people, that might not be the case. So if you look at things like the number of friends someone has or the amount of social interaction, that could vary hugely across different autistic people, who might be happy with very little time interacting with other people, or might want a lot more and not be getting it. And so for different autistic people, it's going to be a really different picture. And I think it's really important that we really individualize how quality of life is seen for each autistic person, and we can look at those different quality of life domains and really think about it from an autistic perspective, because so much of the work that's been done relating to quality of life has included those sort of normative ideas about what good quality of life ought to look like.
So what will people be thinking about in this week as they move forward through the materials?
So we're going to look at the quality of life domains in more detail, and how we should consider autistic perspectives within each of those, and also how we can then consider how autistic people can be supported to live their best lives. So an awful lot of the narrative around autistic people is one of deficit, it's one of disorder, and autistic people effectively being unhappy. but we're going to look more at how autistic people can be happy and fulfilled and joyful, and find ways that support autistic people in order to access such happiness and joy and so on, rather than looking at ways to reduce how autistic people are. It's about making people autistically happy rather than less autistic.
So in this track, we have been focusing on co-occurring conditions. We have been thinking much more about mental health and the impact of mental health on autistic people. And we've been thinking about the barriers to being able to access healthcare. And then this week we have finished by thinking about quality of life for autistic people. George, what are the key points, do you think, from this week?
I think the most important key point is that we need to listen to autistic perspectives and perspectives from all different types of autistic people, whatever their experiences are, and really respect those and use that information to inform practice and work with autistic people so that their voices are included in the way that services are designed, and really to believe what autistic people say about their experiences, about what they need.
One of the things that I'm interested in is thinking about autistic people who have intellectual disabilities. And so I think you're absolutely right that autistic people need to be believed, that non-autistic people need to understand that the non-autistic worldview and the non-autistic world experiences are likely to be different, and that non-autistic worldviews and experiences are not the way, they're not the only way, they're not the right way. For people who are autistic but have complex communication challenges, such as autistic people who also have intellectual disabilities, I wonder how we ought to use the information that we've got from autistic people who are able to tell us about their experiences and what to do and how to help. And I wondered what you thought about people living with and supporting and providing services to that group of autistic people, and how we might use the information that we've got from autistic people's experiences.
I think there's a lot of things that we can take from that information that we have. So there's going to be a lot of autistic experiences that different autistic people share. So we know about things like sensory differences, and whether someone can tell us or not. There might be other ways that they tell us that, I don't know, that the light at the dentist is shining in their eyes is too bright. And we can still use that information to change the way people practice in healthcare. Another thing I wanted to mention was there are actually a lot of autistic people who also work in healthcare. We've talked a lot about non-autistic people in healthcare, but there are an awful lot of autistic sort of doctors and nurses, midwives. I come across a lot of autistic people in healthcare professions, and they also need support and should be supported professionally, but they're also incredibly valuable in terms of supporting autistic patients.
So we should at least consider all the information that we're getting from autistic people about their experiences, and look at whether any of those things might be important for us to consider when we are providing healthcare for, or supporting, or thinking about quality of life for autistic people who have intellectual disabilities.